Hi everyone, good
Hi.
morning and welcome to our virtual coffee morning. I know a few more people are just joining, so we'll just give that a minute, but I am joined by Sandy Green and Ruth Crofford. So hello to you both, good morning, thank
Hi.
you for
Morning.
joining us. So we're going to be talking this morning about implementing weight loss services in clinic, specifically about the National Medical Weight Loss Programme, which is, so Sandy is the founder, and, oh, where am I? So are we? Yeah, we are streaming. Yes, so Sandy Green is a nurse consultant and founder of the National Medical Weight Loss Programme, and Ruth is an aesthetic nurse who uses the service in clinic. So we thought it would be nice to have Ruth on here as well, just to talk a little bit about her personal experiences with the programme and to give some kind of tips and advice for implementing for anyone who's interested. So let's get started. So this is going to be more of a kind of chat back and forth in some of the other sessions. Sandy does have some stats and things that she's going to show us, so we'll do a little bit of screen sharing, but if anyone's got any questions watching, then if you just pop them in the chat box, we will have time for a little Q&A at the end, if there's anything that we don't cover. So, yeah, let's get started. So, Sandy, do you want to just tell us a little bit about the program and why you founded it? Like, what was the kind of journey behind it?
Yeah, sure. Well, first of all, thank you for inviting us and giving us this opportunity, Georgia, to actually talk about the National Medical Weight Loss Programme. It's a personal history of mine, and for those delegates that do actually come on the course, they kind of find out about my own, if you like, demons with weight gain, particularly when I actually hit the menopause, which I always go into and I always get emotional about at that time, because it always just takes me back to those feelings whenever I sort of talk about it. But in a nutshell, it came about from a meeting with one of the Novo Nordisk reps, and we developed quite a good relationship. But quite simply, in the history behind it is that in 2017, NHS England offered 100% availability for all bariatric surgeries for those people living with overweight and obesity that actually met the criteria for actually having that surgery. But things changed in April of 2017 when CCGs took over commissioning. And by the end of that year, instead of it being granted to 100% of people, those provisions came down in just 2017 to just around about 73%. We now believe that those figures are down at probably about 50% now. So we're looking at a gradual erosion of obesity services up and down the UK, with specialist clinics referred to as tier 3 clinics that were usually attached to hospitals actually losing their funding and therefore closing. And we get ourselves, or we arrive at a particularly bizarre scenario where GPs are no longer funded by their CCGs or allowed to by their CCGs to actually prescribe 2 of the 3 weight loss medications that are available in the UK. Not because they're not effective, because they are effective drugs, but because NICE decided that they were actually not cost effective. So it's brought about a huge problem, because the decommission of services means that there is nowhere now for people to go to for support and treatment for people living with obesity. So it leaves a huge gap in the market, which I recognised. And so the solution really was for me to actually develop some sort of programme to educate and train registered healthcare professionals how to treat people living with overweight and obesity. And it's our vision to ensure that everybody living with obesity has access to treatment. And we want to do that by helping others set up those training centres and treatment centres. So that's pretty much it.
So then where did it kind of, for you, Ruth, how did you get involved, and kind of why did you want to take on a service like this, and how did you get in touch with, I keep going to say the abbreviation because whenever we talk in email and we talk about it, we do the abbreviation, but in my head I don't think I'm going to say it right. So
just call it National Medical. That's what we just the weight loss program. So just anything.
So yeah, Ruth, where did your kind of journey start with it? Why did you end up going for that over something else?
Well, I think for us, it was kind of patient-led. So I think really for about the past year or two, patients had been asking us, did we provide weight loss services? Because in clinic, we offer needling treatments for stretch marks, skin tightening, Endimed, various other treatments for obviously face and body, and people are always keen to see what's coming out and what's new, or they ask you about things they've seen in the media. So initially, you know, I looked at it because our patients wanted us to, and I asked a colleague of mine that works for me, a lovely nurse called Naomi. She went on the course in February, and the uptake was so good so quickly that she didn't have enough time to see everybody. So I subsequently went on the course myself, and because if I'm really honest, Naomi had her own personal journey of weight loss on one of the therapies that Sandy introduced us to on the course, and I could see the health benefits that she was getting. I could see that not only was she losing weight and feeling better, but you know, there's also the issues of self-esteem, self-confidence, being able to pick up a bit more activity. She sort of went from maybe walking her dog for 10 minutes to being able to walk her dog for 40 minutes once she'd lost a bit of weight. And it just was such a positive story right from the beginning. And our patients were all positive initially in the program. So it just seemed like a natural progression for me to go and do the course as well.
And what else do you offer in clinic? Like, what's your kind of predominantly, what are you sort of known for, and how does this fit in? I'm just thinking for someone who might be thinking about introducing the service, what does it kind of sit well with in clinic?
Well, I think that if people are like me, and I think a lot of medical practitioners are the same as me, which is that our priority is that we try and take a holistic approach to our patients. So we try and think about, you know, how well they're feeling in their mind, their body, as well as just doing facial treatments, because we can all get caught up in just treating fillers and toxins, but actually there's an awful lot more to somebody's appearance and self-confidence, and it is a natural progression. And as I say, I think because we offered some body treatments, and we've also offered, for example, the Aquilix back in the day. I'm a bit of a dinosaur, to be honest, Georgia. I've been around for a long time. So I did Aquilix training probably about 11 years ago. And then we moved on, and obviously we offer DSO and various other body treatments. So it all just fit in quite nicely. So I think if you're interested in a patient's general well-being and thinking about every aspect of how good they feel, and also if you offer other services to do with body or face, it's a natural progression.
I actually think that the treatment sits really well, because as the patient starts to lose their weight, one of the potential problems with losing weight really quite quickly, and on our program patients definitely do, is it's important to encourage them to do other things to help to keep up their self-esteem, so to improve their appearance even further. And you can do that with helping them with the skin laxity and the treatment that you can actually do to help with skin tightening and skin remodeling. And even where you get those stubborn areas of fat, it fits really, really well with treatments like cool sculpting and the fat freezing and cavitation. But even treatments like endomology. Endomology is great to help with the reduction of cellulite, but also the smoothing and the tightening of the skin. And so practitioners, as well as helping their patients change their body shape, and therefore and lose the fat, as well as kind of improving their overall health and well-being, you can actually help them to, if you like, resculpt their physiques too.
So maybe kind of putting treatment packages together and that kind of.
Yeah, absolutely. And we've got some of our certified partners do that really, really well. And they're actually looking at the whole whole of the person, because you only have to start to we get really quite emotional when we talk about some of the patient journeys, and I'm sure Ruth will talk about some of those now, but the difference in how that person comes to you or returns to you when they're being motivated, and the change in their self-esteem and how they view themselves, and the change in their entire life, because rarely do you see a treatment in an aesthetic clinic that has such a positive impact on that self-esteem than you see with patients coming back having lost 2, 3, 4, 5. We've had patients that have lost up to 8 stone so far.
Wow.
One of the nurses that runs the clinic with me, she's actually lost 6.5 stone, and you know, it just goes from strength to strength to strength, and the more you lose, the more motivated you get to then go on to actually do other things, and then it just becomes that whole change of lifestyle, which is actually really important in changing those behaviours, because you don't want to go back to being that person that you were living in an obese body.
Yeah, of course. So how does it actually work? Let's talk a little bit about like a kind of general patient journey. Maybe Ruth, if you've got kind of an example you can share.
Yeah, of course. I mean, I think what you need to know, well, what practitioners need to know about joining the course is that Sandy's team really support you right from the outset on how you're going to deliver the patient journey, because obviously we're all experienced in dealing with patient consultations, but there is a lot of information, and it's very, very important that patients are given treatment options. So basically, the patient journey starts with an assessment form, which is provided by the National Medical Programme, and it gathers lots of information from the patient, including things like their medical history, their activity levels, the psychology of their eating, all that kind of stuff. So you get a really good idea from this initial assessment form of the person that you're going to talk to. So the programme is...
Can I just jump in there, Ruth, and just actually say, for every certified partner that kind of joins the program, because we're not just about training, we're a program and we're a community of healthcare professionals supporting each other on this journey, but for everyone that joins us, your clinic is actually added, or your clinics, because you can have more than one location, is added to the national map on where the general public can kind of see who's offering the program. And for every clinic that's actually added, the web team, who have been amazing, actually it spits out automatically your own personal electronic consultation form with your clinic name at the top of it, and you get a URL for that, so that you can add that URL to personal emails, in your social media bio. It can go on your if you've got a website page for it, and so any way that you can use to get the link for your consultation form to your potential patients is certainly worth doing, but it's unique to you. It's filled in electronically and then comes purely directed back to you. It's all fully encrypted. You need a password to be able to open it and read it, but it just means that each clinic has the ability to literally send out hundreds of these forms potentially to their client base. Sorry, Ruth, I'll let you carry on.
That's all right. No, I think that's a really important point, because when we go on training as practitioners, you know, the worst scenario is that you leave that training and you don't have all the tools that you need to see your patients and be fully equipped to deal with them. But the program is done remotely, so carrying on from the assessment form, what I will always do is do a video consultation. This treatment is done by remote video consultation, which makes it obviously a really good practical training course and activity to take on during lockdown. So when I get my patient information back, I schedule a time to have the first video call, and the first thing I'm looking for is to check that they are the BMI that they've told me that they are, because I have heard of lots of online services where people can get pharmacotherapies and no one's actually looking at them. They could be a size 6 18-year-old girl in a bedroom somewhere ordering something online. So this is very different with making that ethical check to see that they are the BMI that they are. And it gives you a really good opportunity to go through the assessment form and to talk to them about what their plans are, how motivated are they to change their activity levels, to look at their calories, to record their information on MyFitnessPal or whatever, so that you can start to get a feel for if that patient is wanting to really lose weight. And of course they are, because no one wants to spend money on treatments that aren't going to work. But at this point, it's all about the consultation. And one of the things about the program is that you do learn about 5 different treatment options. Mm-hmm. So when I speak to that patient, I don't have in my mind, oh, I know what I'm going to do. I like to talk to them and explore whether it might be an oral medication or it might be an injection pen. And I think that is what makes this course very different from other courses that are out there. They're only giving you 1 treatment option, but we've got 5 here. So if you ever find yourself
different, aren't they?
Sorry,
yes, they are all different. Yeah, absolutely. And I think as a medical person, you know, one of my top priorities when I'm practicing is that I'm thinking always about the legal issues and about the insurance and everything. If you're delivering a proper consultation and you're giving people all the options, no one's going to accuse you down the line of saying, well, I rang you up and this is the only option you gave me. It's just not acceptable. So at that point, obviously, I'm gathering information and we'll decide together, the patient and myself, about what's going to be right and what's suitable or appropriate for them. And then I will order the medicine direct from the pharmacy. Sandy has a really good relationship with a man called Kadir from Primed Pharmacy. And I tend to order from him or from John Bannon. And then the medicines go directly to the patient's door. So it's just one safe route all the way. And then from that point on, once they receive their medicines, I do a second video call, make sure that I reiterate all the potential side effects, think about how they're going to cope over the first few days of taking the medicine. And then I tend to check on them either by text or just calling them, you know, a couple of times in the first week. And then I make a scheduled appointment every week to just monitor their progress and see what how much weight they've lost.
Okay. So with the different treatment options, are there also kind of like presumed timescales for them as well? Or like, could someone be on the program for, you know, like a kind of indefinite amount of time? Or is there a point at which you would normally expect someone to kind of completed their journey?
Can I jump in there with that one? Okay. Typically, there's always a minimum BMI that someone has to be at to initiate pharmacotherapy, and pharmacotherapy is just the name given to prescribed medication. So they have to meet an inclusion criteria to start the treatment. But then staying on the treatment, we actually want them to get down into a healthy BMI range, and the healthy BMI range is from 18.5 to 25. So we want to carry on their treatment at least until they get there. And we know from experience from clinical studies that certainly with some of the medications, I'm referring particularly to the injectable medications, we know that there's been studies that people have stayed on those long term, as long as 2 years in some cases. Mm-hmm. What we don't want to happen is that they lose further weight. We want them to maintain the weight, but not go on to lose further weight, so that they then go into an unhealthy BMI on the other scale, so they become underweight. So provided they actually stay in the healthy BMI range, and provided they want to continue and their health issues mean that they actually can continue, then we're happy to keep them on the program.
And kind of on that note, is there dietary and exercise advice given as well? And does that kind of change in terms of like when someone's kind of on the program, and then when they get to that point that they want to be sustaining, like you say, and not losing more? Yeah. Does that advice then kind of get tailored to different stages?
Ruth, do you want to pick that up?
Yeah, definitely. I mean, I think it's really important that you start out from, you know, from the outset, you're going to talk about the dietary advice. And one of the things that I found really useful is with Sandy's program, when you become one of her family or her community of practitioners, you get an awful lot of support with social media images and marketing. So somebody on her team, I can't remember if it's Gemma or Vicky, Sandy, but one of the ladies provides amazing marketing material that will, for example, it will outline, if you're a coffee drinker, how many calories is in this coffee, that coffee, the next coffee. And they go through all these wonderful posts that you can give to your patients, and you can discuss them on your weekly calls. For example, with the weather being better, we've had lots of people having barbecues and probably getting to drink a bit more than they might do if they were, you know, and now we're all socializing a little bit more. So you can really take these posts and you can make a feature out of discussing the dietary advice. There's also posts about exercise, about weight training. So even if you're not particularly knowledgeable yourself about what to do for diet and exercise, you're guided very much by all the free materials that you get once you join Sandy's group.
Yeah.
So, but it is very important. And what you find with a lot of patients, particularly in the beginning, is the feelings of hunger are gone. And it's a very strange process, because as a practitioner, you have to make sure that your patients are still eating. So this is a very big part of the program. We're not just prescribing and then walking away. It is supportive.
Yeah, sure. And so when you were actually kind of implementing the service, Ruth, what were kind of the key considerations and things that you had to kind of really need to think about and make sure that you have in place beforehand, like kind of thinking, I guess, more in terms of advice for other clinicians who might be thinking about doing this before, you know, initially before you kind of get going with it?
Well, I think I'm a bit of a training snob because, as I say, I've been around for a long time. I've been doing aesthetics for 17 years, and I'm used to having a very high level of training. Because I used to work for Tioxane as a trainer and various other companies. So I am a training snob, and one of the things that I wanted to do was, if I was going to do a course or send any of my staff on any courses, it had to be delivered by experts. And one of the things about Sandy's course is it's co-delivered by Dr. Matt Capehorn, who is an expert advisor to NICE on obesity. So I actually don't know anyone else in the UK that's more qualified to co-deliver the course with Sandy. And I had no idea about Sandy's personal journey when I joined on the course. And, you know, Sandy's very open about her journey, about losing weight. And that kind of just was an added bonus, really, to think, well, I've got an expert advisor giving me the training information, and I've got Sandy, who's been through this personal journey and has had first-hand experience of it.
Yeah, I think what people need to kind of be made aware of is that we're not just a training program. I mean, the training program is absolutely excellent. It's 2 full days, so we've got a 13-hour program, and it's very intensive, but it's also very comprehensive. Now, Matt delivers day 1, and on both days we actually have 4 different modules. And Matt covers most of the theory, so he's going to go through the epidemiology, the physiology, talking about the fat cell itself, the different hormones related to appetite regulation, and then we actually go through all of the different weight loss interventions. So, and pharmacotherapy is one of those, but we discuss bariatric surgery. We talk about the different types of diets and nutrition. So we go through the keto diet and the 5-2 diet, and then we look at lots of different forms of intermittent fasting. So they're all things that can be used in conjunction with pharmacotherapy to help your patient, you know, to really succeed on their weight journey. But also in terms of this training snob, if that was the word, I've never heard of that before, Ruth. So when you kind of look at that, our training, as well as it being CPD certified, it's also accredited by the Royal College of Nursing. Now, that's no mean feat, because it took us nearly a year to actually get that. We were going backwards and forwards with modules and making sure everything was in there. But not only is it RCN accredited, the course is also accredited with the World Obesity Federation, and that's through an organisation called SCOPE. And SCOPE stands for the Strategic Centre for Obesity Professional Education. Now, this is actually an internationally recognised certification in obesity management, and it's endorsed by the NHS and over 50 national associations globally. And but because in the aesthetics industry, no one really appreciates the quality or the depth of what that means, SCOPE is huge in the world of obesity. And for us to actually have a SCOPE accredited course is just phenomenal. And SCOPE actually does its own certification, and it's an internationally recognised standard of obesity expertise. But you only need 12 SCOPE points to class yourself as a SCOPE certified practitioner, and you get 3 of those points from doing our course. So it's certainly very worthwhile doing or becoming a certified partner.
And so then just thinking about kind of at the moment and recently, obviously with lockdown, do you think there is going to be an increased demand for this kind of, for weight loss services? Have you heard of any anecdotal evidence perhaps to support that? Obviously with everyone being inside and perhaps not exercising as much as they normally would, and massive lifestyle changes, is there anything, are you kind of preparing for?
Can I actually just take this opportunity then to share a screen, because I want to just share some.
No, go ahead, go for it.
If I actually can. So if I just share these, this is so can you actually see this screen now? Is that all right? Can you see my mouse moving?
Yeah, I can see it. Everyone should be able to, yeah.
So these statistics are from the House of Commons, and they from 2019, so last August. But the statistics are actually 2 years old, so the data is from 2017. But it actually shows that nearly 1/3 of the adult UK population are actually already measuring as obese, so their BMI is over 30. A further 35.6% are actually overweight, so that's from the category of 25 to 29.9. So that means a total almost 2/3 of the adult UK population are already living with overweight and obesity. Now that is huge statistics for us to think about there. And if I actually show you the next slide, sorry, just bear with me. So this, again, the Foresight report, again, another statistic from the government. This was produced in 2017. And this actually identifies the shape of things to come, because following current trends, the government believes that without any intervention, instead of it being 2/3 of the adult population, it's going to be by 2050, that's only one generation away, 90% of the adult population will be either overweight or obese. And 50% of them will be clinically morbidly obese. So that's really important to bear in mind. And from Public Health England, these are some of the statistics on what it's already costing the NHS in terms of the cost of obesity, if you like, to the UK, to the population. And I love this slide because it actually shows us the dangers of being obese and the risk to people's health. And Novo Nordisk very nicely put this together. So anyone within the healthy BMI range, those people, regardless of, it might be car accidents, it might be any different thing, but those people have, in the healthy BMI range, they have an 80% chance of reaching the age of 70. As the BMI goes up, the life expectancy decreases. So someone with a BMI of 35 to 40 has only got a 60% chance of getting to the age of 70. And if you move above 40, you've only got a 1 in 2 chance of reaching the age of 70. And that's really quite alarming, I think. When you actually look at, I'm going to share a new screen, so let me stop that one and share something else. But this is these are the statistics to do with obesity and COVID-19. So we already know from the newspapers the impact that being obese has had on the severity of the disease if people do actually get COVID. So somebody who's obese has a 3 times more chance of being admitted and getting a higher risk or a worse form of COVID-19, and consequently a longer stay in hospital. And for every 1 point of increase in their BMI, so even from sort of 26 to 27, it increases that person's likelihood by 12% of developing severe and complex issues to do with their health. So when you're actually asking the question, anecdotal evidence, we can already see that people have been all over the social media complaining about the weight that they've gained during lockdown, whether it's boredom, whether it's lack of activities that they've been able to do previously. But yeah, that we're going to be inundated. I know certainly in terms of delegates coming on the course, we've seen if you like, a 5-fold increase in demand for practitioners actually coming on the course, because this is obviously a service that you can run from home, from the comfort of your own chair, when you're both consulting remotely and prescribing remotely. So yeah, very much so. What do you think, Ruth?
Yeah, I agree. I mean, I don't think I know anybody from all my family and friends group that hasn't complained about putting on weight, you know, but your statistics there, you know, even if there wasn't lockdown, it shows you that there's going to be a massive demand for treatments for obesity. And like you said, right from the outset of this conversation, the services are just not there in primary care to help people. Like we see so much, don't we, in aesthetics, we're gradually seeing more and more of a crossover where we're delivering services that you just can't get from your GP or primary care service. But certainly lockdown has been challenging for a lot of people with weight gain, and the gyms are still closed, aren't they? So, you know, for some people, it's just really hard for them to keep their weight down in the situation that we're in. And psychologically, we're all frustrated. People are acting in a more angry way. There's not a lot of positivity with lockdown. So I think it's a really nice service to be able to keep in touch with your patients if you're not open or not opening tomorrow or whatever. And it will also be there for the future. So it's a great investment in terms of training.
Wonderful. I'm just a little bit conscious on time, so I think I'm just gonna ask you. Yeah, so I think we've got time. We'll do one more question. What are the considerations in terms of? So I know obviously people need to be a medic to do the training, but Sandy, what other kind of qualifications or previous training, like who is an ideal candidate to come on the course and offer the service?
Yeah, it's a question, and we get emails on a weekly basis from non-medics wanting to actually come onto the course, and it's an absolute no-no. We will only train registered healthcare professionals. Now those healthcare professionals are varied, so don't get me wrong, it's not just doctors or nurses. Anyone who has the legal authority to prescribe prescription medication can become a certified partner of the program. So that's the first consideration. In terms of their experience, a little bit of experience would be nice. We actually get quite a few diabetic nurse specialists who have actually converted to offering a private service as well as their NHS service. But anyone that's interested in helping people or patients living with overweight and obesity, and you've got to have a general interest, a specific interest and a desire to want to kind of help these people, and that's really important, because you won't get the job satisfaction. There's nothing like it in when these people come back and you see them that they're crying and they're just so grateful that they've actually found something that actually truly helps them. So that's in terms of training. Ethical issues, I think, provided we're very strict on the criteria for the actual protocol that we follow in terms of who we can prescribe to. we're strict on how we actually do the virtual consultation, just to make sure that we're following the rules and the guidelines. And likewise, we're strict about following the MHRA guidelines on our responsibilities when it comes to prescribing off-label medication, which is what we do an awful lot.
Wonderful. Cool. Well, I think we're gonna just have to wrap up. Well, someone's just asked us. So someone just joined a little bit late. She's a dentist and wondering how she can join the program and take the course. So she's popped her email address in. So what I'll do, Sandy, is I'll pass that, Sherry, I'll pass your email on to Sandy. And Sandy, if you could maybe just get in touch. Sherry, this is also being streamed to our Facebook page on aesthetic medicine, and it will stay up there. So if you wanted to go back and watch from the beginning, you can do that as well. But
I can't see those questions, but Sherry, let me reassure you, we've probably got, we nearly always get a dentist on every single course, and we get 20 delegates per course typically. So you're in good company.
Cool. Well, thank you. I think that's all we're going to have time for. But thank you both so much for joining us, and I hope everyone watching that you found this useful. And if this is something that you would like more information about, or you'd like to get in touch with Sandy, maybe Ruth, to hear her experiences with kind of another point of view from a clinician, then do let us know. You can always just let us know through the AM social media channels, so we can pass anything on to anyone. And yes, well, thank you. That was great.
Thanks, Georgia.
Thank you so much, Ruth and Sandy, for joining. And I hope everyone has a good day and a lovely weekend. And we will be back soon with our next virtual coffee morning, which we'll have information about in due course.
Was I the only one actually drinking coffee? Because no one else had one. I specifically went.
I've got water. I normally do.
Right, okay. I kept sipping and no one else was drinking. I thought, this is not a coffee morning, is it? Get the cake out.
I've let my own team down.
Oh, bless you.
No, cool. Well, thank you so much for joining us, and thank you everyone for watching.
Thank you.
And yes,
Thank you, everybody.
soon.
Take care.
Thanks so much.
Bye.
Bye.
Bye.